Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with people who are making it happen. We are the fastest growing podcast in the health IT space. My name is Bill Russell. We're covering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is brought to you by Health Lyrics. Have a struggling healthcare project you need to go well? Let's talk. Visit healthlyrics.com to schedule your free consultation. If you're enjoying the show and you want to support our mission to develop the next generation of health leaders, there are 5 ways that you can do that. The first is you could share it with a peer. The second, share it on social media. Third thing, you could hit our social accounts, LinkedIn, Twitter, YouTube, and share our posts with others, like them, all the other things that you do on social media. Fourth thing, send feedback, questions, and guest recommendations to me. I'd love to keep expanding the number of people that we are associated with and bringing into the community. And the fifth thing is you could subscribe to our newsletter on the homepage. Speaking of new people, today we're joined by Terry Ziemniak. Terry, is that right? Ziemniak?
Well, if you're my Polish grandma, she would say Ziemniak, but it's become Americanized and now it's Ziemniak.
Ziemniak, got it. He's the president of North Wonders. He was referred to me by Starbridge Advisors. Do some work with them as well. You are a CISO that has done many stints across healthcare, Peace Health, Carolinas Healthcare, now Atrium, Presence Health, and others. Well, I guess good morning. Welcome to the show.
Hey, good morning, Bill.
You know, the CISO is probably one of the hottest jobs in IT right now. It's really, my understanding is it's really hard to find good CISOs. It's really hard to get contract CISOs as well. What types of things have you been working on over the last year?
Well, it's interesting. I'm working with a couple partners to help address that problem. A lot of the smaller and mid-sized organizations, healthcare or otherwise, are really struggling finding that CISO talent. So generally going to be an expensive person who can help bridge the conversation between business and technology. There's not a lot of people that fit that space well, and they're pretty expensive. So we're seeing more and more need for what we call fractional CISO or virtual CISO. And more and more programs are being developed where you can effectively rent a CISO to build a program, to build your strategy, to build your roadmap documents, get the buy-in from the organization, and then effectively hand that off to the IT organization. So I think that's actually going to be a trend going forward as these smaller mid-sized organizations have a need for that skill set. Security in those cases are typically handled by an IT manager or perhaps a security director who may or may not have that skill set to really interact with the business organization, the business side, because at the end of the day, security is there to protect the business. And if you don't have that interaction and communication between business and security, you're going to go off tracks and not get the support that it needs. So these virtual CISOs are filling that role to help, again, build roadmap and strategies and have the conversations to align the two, and then allow the in-house security and IT staff to execute those roadmaps.
Yeah, fractional CISOs join the fractional chief marketing officers and other fractional services that are out there, which I could see it in this space. Whenever you have trouble finding really high quality talent and you have a significant need, those kinds of services come into play. So for today, we have we try to keep these things to 30 minutes, and we have so much to cover. We're going to cover one topic for our discussion today, and that's security. And one of the things I always find interesting is the number of listeners when I put security in the title of the podcast. The number of listeners is always lower than other topics, and I think that speaks to they're struggling with security. They don't want to be reminded of it. But everyone recognizes that it's extremely important. So let's start. I'm going to start in a little bit of let's put ourselves in a boardroom. I'll play a board member, put my board member hat on, and just throw a few questions that I've received in the past in board meetings. And I just, with someone with your expertise and experience, I'd love to get your background. So, the first question I think you might hear from a board member is, they really only need to breach you once. They only need to get in once. If they have one credential, they get in, they're on the network, they figure out a way to get to things. You're breached. They have your data, they can get to your data. How can we not be shooting for 100% in this area? Because most CISOs would say, look, we just need to improve from 90% to 95 to 98, but that 2% leaves us vulnerable, doesn't it?
It does. I think a couple of things come out of that question you had there, Bill. One is 100% really is not achievable. If somebody has the resources and the time, they're going to get in. And to shoot for 100% is unrealistic. You're never going to get there, and you're going to go bankrupt along the way. I read an interesting article from the American Bar Association. They had guidance for legal organizations. And to summarize their guidance is go and be pretty secure. Get the 85, 90% done, and then ensure the rest. So it's even from ABA directly, they say don't shoot for 100% because you're not going to get there. Companies are breached all the time. So there's a difference between a breach and then data theft. So viruses and phishing and bad links, bad things are happening in large organizations all the time. It's just kind of unavoidable. And that's the idea of defense in depth. Maybe they get into a user population, or maybe they get into certain accounts or certain areas of your network. But your crown jewels, if you've identified them correctly, you have extra protections on those crown jewels. So just because they're in, perhaps they may not be able to find the data. If they find the data, perhaps they don't have access to the data. If they have access to the data, perhaps they can't exfiltrate the data. So you want to put those layers in place, assuming that they're going to occasionally get through the lower levels of your controls. Hopefully we'll get stuck before they get to the top layer and actually are able to take their crown jewels. But again, 100% is just not reasonable with a realistic budget. I've always said we don't want to spend $1,000 on $1 million problem, and we don't want to spend $1 million on $1,000 problem, and that's where risk management comes from, the idea of risk management. How much do we want to spend? What are our priorities? Because you got an unlimited budget in security and probably still never be 100% secure.
Yeah. So three other quick questions I think I often get from board members is, how do we know there isn't somebody already in there exfiltrating data?
Well, there's that, even that in itself is kind of a loaded question. When you talk about data, I think a lot of companies even don't have a full inventory of their data. Where is your data? Are we talking about Bill's personal smartphone, his Gmail account, the cloud, your network, your vendors, and your partners? Your data is all over the place. So really, I think a lot of companies struggle with the concept of even where is the data. But the question is it being stolen within a certain network? It's certainly possible. There's tools that do a good job detecting that. But as more and more traffic becomes encrypted, you can't necessarily see the traffic. So then you have to kind of take another level of abstraction back. Is it coming from a data store that's important to you? Is it going to a known bad IP address? So it gets more and more complicated. It's ever-evolving threats, which require ever-evolving controls to address those threats.
Yeah. So why are they going after health data? What's the value of health data on the open market?
Well, it's interesting. There's an article a couple of years ago. Just historically, the value of healthcare data and records have gone up, up, up. And the idea being, as compared to a credit card numbers get stolen. Visa writes off the loss and changes the number, no big deal. It's really hard for Bill or for Terry to change a social security number. And that's where the value of the medical data comes, because it doesn't change easily. So once you have it, you can get a lot of value out of that information. However, there's been such a deluge of healthcare breaches that on the black market, the value of medical records has peaked and is going back down again now.
I guess that's a positive.
Yeah.
I mean, the other thing I hear from board members is, we've seen all these breaches. What has been the business impact on the organizations that have been breaches? Clearly, they have fines, but they also have insurance, as you stated earlier. There doesn't seem to have been any major blowback in terms of the revenue and the profit of organizations that have experienced large data breaches.
Well, true. I think that's a valid statement, and it comes down to, from your business, again, what's the business objective of cybersecurity? Is it to prevent 100% of the breaches? Is it a marketing aspect? I have a client I'm working with, and I spoke to the CEO. She said specifically, objective 1, we need to protect the data. Objective 2 is we want to use security as a marketing tool. Perhaps your business objectives talk about the ability to share more data overseas. Perhaps you're worried about compliance. So you really need to understand what the business objectives are to build a security program. You can't protect, you can't defend against everything. Insurance is there. It's designed to fill those slots. Maybe you only want to be 95% secure and you don't want to insure the rest. So what's the direct impact? An interesting article I read, Bill. They talk about healthcare specific, how the cost of marketing goes up post-breach. So healthcare organizations that have been breached, how their marketing budget the 2 years following goes up. So there are some direct costs, but it's not enough to shut companies down. Recently, OCR made some announcements saying that the actual caps for HIPAA breaches are going to go decrease. So it is difficult, and that's why board members and organizations are struggling with the concept of how secure do we have to be if they're not seeing a lot of direct tie of revenue to those breaches.
Well, let's okay. So I'll take my board hat off, and I sort of want to have you walk us through. I've seen some of your slide decks, some of your presentations, and I'm going to walk through because some of it's pretty. I think it's really valuable to our listeners. So just give us a state of security within health IT. What are you finding in the industry today?
Sure. So, well, the research you're talking about, I'll give a little background on that first. Working through UNC Charlotte, University of North Carolina, Charlotte, I got tied into a entrepreneurial program for a company that I'm working on. And part of that program included customer discovery. So, hey, entrepreneurs, you may have the best solution in the whole world, but if it doesn't meet the business need, no one's going to buy it. And that certainly makes sense. So I was tasked as part of this program to go talk to a lot of executives about security. And when I was all said and done, I had dozens of interviews with leaders throughout healthcare and other industries saying, this is our thought on security, and this is where we think we're headed. So it was great information. I tied it together and made a presentation based on it. So that's some of the numbers that I'm going to review with you, Bill, today. But specifically, what's the state? I start off with, hey, executive, how confident are you in your security controls? Do you think you have enough? Do you not have enough? The majority felt they were actually good. They said their security controls were solid and they had high confidence in their security controls, which was kind of interesting. About a quarter then on the other end of the spectrum said they had little to no confidence. So it's kind of a big gap there, but there were people on both ends of that spectrum. Then I took the next step, Bill, and said, well, great, your security program is either good or poor. Let's break it into the pillars. So security really is not a monolith. Security consists generally of people, process, technology. And I said, okay, if your security program is great or it's poor, what do you feel about technology? And pretty much everyone said specifically technology is in great shape. Our technology part of security, we're very comfortable with. Okay, and I said, great, technology, process, where on process? About 2/3 said, yeah, our processes are very solid. The rest also then said that, well, our processes are pretty good. So no one had any big concerns about processes. Then I took the last pillar, technology, process. Let's talk about people. Almost everybody said people was the biggest risk of their security program. So it's interesting when you take the idea of security as a whole and then break it into pieces. What are the concerns? Technology is not the concern because technology is easy to sell. The idea of, well, we need $100,000 for a firewall, or we need to buy this service. So there's things that are you can see and you can touch and you can understand. The people side of cybersecurity is really the gap. Is they don't know how to move the needle in there, and they don't really know how to get the value out of the thousands of people perhaps working in the organization. And that was kind of a gap everyone acknowledged, and they really didn't know how to deal with it. But they also did say people had the highest potential for improvement. So technology is in great shape. It can't improve much. We don't want to put our effort there. All of them, nearly all of them said people's our biggest risk, and they all said people also have the highest opportunity for improvement. So that really, I think, gives you some visibility where the CISOs are looking. Is they see the hole in the people side and they want to shore that up.
Yeah, it's it's interesting. I've mentioned this a couple of times. When you have 23,000 people, or 30, or 40, or even 90,000 people in an organization that are willing to give away their credentials with a phishing attack or those kind of things, that becomes your attack vector, and you have to figure out a way to shore it up. I don't necessarily agree that the process and technology is baked within healthcare, and I would really, we're going to focus in on the people side today, because I agree with you that it's a majority of the challenge and an area that we can improve significantly. But on the process and technology, but we spend too much time building walls, not enough time analyzing what's going on the wire, doing an audit of our data and where all that data is, an audit of our business associates and our partners and what their security practices are, an audit of our cloud partners and their practices. I think if you really dig into IT, you're going to find a significant failure grade in terms of security. And I know I'll get in trouble from some people who say, well, that's not indicative of all healthcare, but I think it's indicative of a lot of healthcare, unless you're at scale, unless you have enough money to throw at this. I mean, and by enough money, I mean, $4, $5, $6 million a year to throw at this. You probably need to get an outsourced provider because you don't have the expertise and the controls to put in place. Now, with that being said, I want to go back to people, process, technology. It's a common framework, and it's there for a reason because it is a good framework to work from. So if we can improve on the people side, let's talk about some of the things we can do on the people side. So what are some areas that we can prioritize to make our culture better, to make the people aspect of our security better?
Well, I think the big problem that I definitely heard during the interviews and I've seen in my experience is people are really not using risk management concepts to the awareness program. So every CISO is going to have some sort of risk register. I'm worried about X, Y, Z. I'm worried about clinical engineering devices and shadow IT and cloud and personal devices and down the road. But that is not being used as input into the awareness program. People touch all of those risks, and people can help mitigate those, not necessarily eradicate the risk, but it will reduce the risk by having more people aware of what's going on. So I think one of the key things is expansion of the awareness program. Pretty much everybody does phishing tests. So we'll send out an email. If you click on it, you get a pop-up saying, hey, Terry, don't click on that link. You shouldn't have done that. And here's why. And that's great. It's certainly a value. But not many people are looking beyond phishing. Are they educating people on, people may have their own backup responsibilities, encryption. The number one breach, according to OCR with the HIPAA wall of shame, is unintentional disclosure. So emailing things to the wrong people or not encrypting it. Those sorts of simple mistakes, it's just a user awareness factor. So again, what I'm seeing is that people are very myopic and they're looking at a single topic when it comes to awareness. But Ganesh, when I was a CISO at the previous organizations, very large multi-billion-dollar companies, I generally had a security staff around 10 or 12 people for multi-billion-dollar organizations. And there's 10, 20, 30,000 people. You can't secure 30,000 people with 10 security folks. You need all 30,000 people, in theory, all of them, but you need all of them thinking about cybersecurity. You don't need them all to be firewall engineers. You don't need to be pen testers, but you want them a little cynical. You want them a little mindful. And that's really the objective that I'm hearing.
Yeah, we almost have to start thinking, we have to start thinking in a nefarious way, like how would people get into this environment? And when I sit across some security experts like yourself, they talk about, simple things like, giving people access to your building. And, you don't think about that in terms of your security program and access to, being able to walk by, certain screens that aren't shaded or whatnot. And then you also end up with actual employees who've been compromised and are essentially selling the information as sort of their side job. I mean, so there's so many different ways that you can be breached. And so how do you build that it needs a culture, right? It needs a culture where, as you say, 30,000 people are thinking about security. So how do you do that? You have 15, 20 staff. Let's assume we give you 25 because we're feeling
generous. Well, thank you.
Generous. What are you going to do? How are you going to do it? How are you going to build that security culture?
Well, that's interesting because organizations that have been struggling with that concept forever is how do you set the right culture? And maybe what is the right culture and how do you set the culture? What I've seen that works is it needs to be a multi-pronged attack. You're not going to change the culture by going to the board or the C-suite and getting those 10, 20, 30 people on board, because that does no good. They're up in their ivory tower. You're probably also not going to make significant change if you're only working on the end users. So if your receptionists or your nurse or your finance or your HR people think about security, that's great. But if they don't have the support, it's not enough. What you really need is hit the third tier. You need to hit the middle management as well. So things like manager talking points, things like security risk assessments on staff. Hey, Bill clicked on 5 bad emails this year. Bill's boss should know about that. If Bill's not participating in the annual training, Bill's boss needs to know about that. So if you have the executives participating, supporting, and tracking these concepts, you have middle management talking about and supporting and reinforcing these concepts, and then you have the end users hearing about these concepts and learning about these concepts at a user appropriate level, what I call it aunt and uncle level concepts. The 3 of those really I've seen help change the culture, because it's hitting all the different areas and it's supporting itself.
Yeah, that makes sense. So this past couple of months, we've seen major breaches, Quest, LabCorp, that were initiated through business partners. How do you involve business partners in a security program?
Well, it's interesting. So previous 20 some years of my career, I've been on the corporate side as a security lead, knocking on the third party and the vendor saying, hey, are you secure? Are you secure? And historically it consisted of, here's a spreadsheet and convince me you're secure. Now that I'm in the consulting space the past couple of years, I'm actually on the receiving side of those spreadsheets or those assessments. And it really is a whole different perspective of, if I'm a data analytics company and I have 6 different healthcare organizations I work with, I've got to answer these questions 6 different times. They may have different answers for different companies, and they may be nuanced and whatnot. So really as a mess is how do you shore up that relationship between your partners and the healthcare organization itself? What is the right answer? I don't know that anyone's figured that out yet. There's services you can do. I think the answer is something like a high trust sort of certification. So working with my service provider client that I'm working with, they're going to drive towards high trust. So then when the healthcare organizations say, hey, convince me you're secure, they can say high trust says we're secure. Of course, it doesn't guarantee security, doesn't guarantee you're properly secure or secure enough, but it is a stamp to say at least the bases are covered. And I think something like that is really what needs to happen is, these poor vendors and partners cannot keep answering these same spreadsheets over and over again. They just provide so little value. And in many cases, the hospital itself doesn't even review the spreadsheet. The instructions we're getting from the healthcare provider says, just make sure none of the answers on the spreadsheet are blank. As long as there's something in every single cell, we'll pass you. And that's the information that the kind of low-level users actually execute the spreadsheets are hearing back and forth. So I think what would really help is the idea of a third-party kind of assessment to say, yes, they're secure.
Well, that's a culture of patient safety, a culture of security has similar characteristics. If the IT organization feels like there's so much pressure on innovation, on moving projects forward, on those kind of things, they may shortcut certain things. And this is why you have different levels of security and different oversight. But at the end of the day, a culture of security has to drive the same level of priority for the program through the entire organization. It can't, it can't be at different levels on the organization based on that department's priorities, I guess is what I'm saying.
Agreed. And interesting engagement I had last year is I worked with a larger healthcare organization to move, they brought me on board specifically to move security outside of IT over to legal organization.
Yeah.
So they brought me on board, the CIO was on board, which was great. And we got that done, but it was in a whole different perspective of the world when you're outside of IT. So as building the CISO office and running as the interim CISO, it gave me a level of visibility, and I was able to talk high level concepts that really went beyond the ears of the CIO. So when we established program concepts and policies and standard, it applied to the data, whether it was responsibility of the CIO or perhaps our clinical engineering department or our cloud providers or our partners or our vendors down the road. Being outside of IT allowed me to discuss and formulate, again, an umbrella of security that covered our data and our devices, regardless of where they sat and who was responsible for them. So Good for that company. It was a big win getting that done.
Yeah, and one of the first things I did as a CIO, only because I was interim CIO for about 3 weeks when we had a breach, and I saw the impact of that on the entire organization. Every project comes to a halt. You have to do a response. It's just a huge undertaking to respond to a breach. And so one of the first things I did is I took a look at the security practices. I said, well, this is not going to work. So we hired a chief security officer who had a digital background as well as a physical background, and brought that together. And then that person ended up reporting into compliance, and they became a peer of mine and oversaw things. Now, I still had a CISO within IT, but that CISO was primarily focused on digital and had oversight from the chief security officer, which was it felt like it was a pretty good model. But they work very closely together. So just for fun, let's you have in one of your slide decks, you have good Bob and bad Bob in terms of a security culture. So contrast the user within an organization. You have 30,000 employees, 50,000 employees, or even 3,000 employees. Contrast a person with the right mindset and a person who's maybe not tuned in.
Right. So again, the caveat: these aren't my words; these are the surveys. So, so I'll go through these. Part of the exercise was, hey, executive, let's talk about your users. How would you describe the goal? What is your good Bob, and then what is your bad Bob? And it was interesting the things that I heard. So bad Bobs were described as things like not paying attention, clicks through anything, doesn't get it, things like that. Also, a lot of them mentioned older. It was an age issue. And I don't know as old so much that it's strictly the age, the birthday sort of concept, but it does bring to light the idea that you have people with different backgrounds, different perspectives, different acumens. So perhaps an 18-year-old's idea of security and privacy is going to be different from someone who's 30 versus someone who's 50. Someone who's very comfortable on a computer, you have a different concepts of security versus someone who is very uncomfortable with the technology. So that just speaks to the need that when you work with people, you need to understand their point of view. The objective, again, is not to make everyone white hat hackers, but you need to make them all a little more engaged and a little more involved in the program. So those are the kind of things that I heard when I asked people about bad Bob. On the good Bob, it really is a couple of key things. Mindful, different ways they described it, but mindfulness. So slowing down, understanding the concept, taking a breath before you click. That was a common thing. Empowered. If you can get people to feel comfortable protecting themselves at home, or taking personal responsibility to encrypt files. So the more people are doing things and participating in the program, the more empowered they are. So empowerment's another one. Engaged. So are they thinking, or do they feel a sense of accountability? Engagement's another big thing. And lastly, what popped up was the idea of literacy. Many people in the organization just are not technologists. And I think as CISOs and CIOs, we often forget that a lot of people don't really understand technology. They're not comfortable with technology, and maybe they may be afraid to even talk about it. So basic literacy of the technology, of the threats, of the risks. You need to have those sorts of basic concepts for people to really participate in your security program.
Yeah. So what are some, you talk about metrics a little bit, but what are some common metrics that a good program will have in place to measure their success of their program?
Sure. Well, metrics is interesting. Everyone agreed that I spoke to, metrics are important. I think just intuitively, we all understand the concept of what's measured can be improved. If you don't really know where you're starting from, you're not going to know if you get any better. Common metrics are people that do phishing tests, measure click rates. Some of them, all of them track CBT participation, so your computer-based training, your annual videos that you look at, they all track that. They may track participation in presentations if they give those. The fourth common metric is submitting phish tests, or actual phishs to the help desk. So the idea that Bill got a bad email and he was cognizant enough to send it to the help desk saying, hey, this looks suspicious. So those are common metrics. The problem with metrics is they don't really apply well to awareness. when awareness is just the idea of culture, right? How do you measure mindfulness? How do you measure engagement? There's not a good answer to that. But the companies that are more advanced in the awareness space, they do things like focused campaigns. We want specifically to talk about patient identity theft. Those are focused campaigns that I've seen run before. And when you get to a focused campaign and you have specific objectives of patient identity theft, maybe you want to measure and you want to get the understanding of patient identity theft to go up across your department. Maybe you want people to have a better understanding of the FTC red flags tied to identity theft. And maybe you want to increase the number of reports of red flags, suspicious sorts of activity from your finance group. So if you have a focused campaign around objectives, then you can make very specific metrics. I think that really is the gap on the awareness metrics front, is people trying to measure culture and mindfulness and engagement, which is hard to do. But if you had specific objectives, if you had a specific campaign around, again, identity theft or password misuse or smartphone protections, then you can have metrics to support those objectives.
So Terry, I have two more questions, and I'm going to do something different on this show. We're going to close up the show. I'm still going to ask you the two questions. I'm going to record them, and then we'll put them out on social media, but they're not going to be a part of the audio podcast. So if people want to tune into those, they'll have to follow social media or subscribe to the free newsletter. You'll get it as well. So this is a great discussion. I really appreciate you coming on the show. We're at our 30-minute mark. So is there anything you want to leave the listeners with, how they can follow you or get in touch with you?
Yeah, absolutely. Thank you. My website is northwonders.com, so feel free to visit me over there. I'm very active on LinkedIn. I regularly post information that really is leadership level content on cybersecurity. So telling the story of Mandela's, who's the Oreo cookie manufacturer. They had an interesting story where they were hit with ransomware and then took that cyber claim to their cyber insurance provider, which was Zurich, and Zurich denied the claim.
Wow.
So having those conversations and having leaders hear about specific cyber attacks that directly impact business, $100 million cyber claim is going to impact business. But having those leadership level awareness concepts, I regularly post on LinkedIn about that. So that'd be a great way to see what I'm talking about and visit me on LinkedIn.
Fantastic. So follow you on LinkedIn. Thanks for coming on. Please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday, we take a look at the news, which is impacting health IT. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekinhealthit.com or the YouTube channel at thisweekinhealthit.com/video. Thanks for listening. That's all for now.